I'm Heather Bowers with Lone Star Benefits. We've put this video together for you to walk you through step-by-step instructions on completing the Blue Cross Blue Shield employer enrollment forms. Part of the video is going to focus on the benefit program application form. Part of it will be on the employer group information form, and part of it will be on the supplemental form for those of you that will need to complete that form. If you walk away and come back later to complete the forms, and maybe you just need to jump into one of the forms and not all three, you will find the times to my left on where it is in the video for you to start on that form. We look forward to receiving your completed forms, and thank you for trusting us with your benefits program. The first form we're going to look at is the Small Employer Benefit Program application form. As you're completing this form, you will go through each box. So the first box is just going to be the legal name of your company as it's found on your formation documents. The next box will be your employer identification number. This is the same as your tax ID. For the nature of your business, you'll just put a general idea of what you do. So if you do consulting work, just write in consulting. If you're an HVAC company, just write in that. For the standard industry code or SIC code, if you know what your code is, it's a 4-digit number, write it in there. If not, we'll be able to find that for you. For your physical address, just list where your company is located. The email address is going to be the authorized company official that will be signing all of these documents. Below that, there is a secondary email address. That would be maybe if you want an HR director to also have their email address on file, or someone else at your company. And then you'll put in your telephone and your fax numbers. The complete mailing address would be if you have a mailing address that's different from where your physical location is. And then the billing and correspondence should be to whoever at your company that will be receiving your bill in the mail each month. When you get to the billing methods section, that's going to be how your rates were reflected on the proposal. So some of you will have composite billing or composite rates, and that's going to be the 4-tier rating structure where all employees will have the same rate, regardless of age. And then some of you will be enrolling with age billing, to where each person enrolling is going to have their own unique rate based on their age. The next section down is the Blue Access for Employers portal. So once you're set up with Blue Cross, you will have a portal where you can log in and pull your bill. You can look at who's covered under your plan. And so in this section, you would just need to list the name and the title of whoever at your company will have access to that portal. And then you'll also put their email address in there. And then the last box on this page is going to be your effective date of your plan. Flip over to page 2. This is where it starts getting into how your plan is going to operate. So under number 1, that's where you're going to put your waiting period. The coverage will always start on the first day of the month. And as the employer, you can decide if you want to do it based on first day of the month following 0 days of employment. So that would start immediately after they're employed. You can do first of the month following 30 days or first of the month following 60 days. For B, that's going to be if you want to waive the waiting period on your initial group enrollment. So what that means is that if you have an employee that just started for your company, but maybe going forward, you're going to have a 30-day waiting period, this will give you the option to waive that waiting period for anyone that would otherwise be in a waiting period. Most groups do have an employee continue to serve their waiting period, even when they move to a new carrier. For C, you'll just list the number of employees that you have that are currently serving in a waiting period. And then for D, this will be if you want a different waiting period other than what you put under A. So some groups have a 90-day or 120-day kind of a, waiting period before an employee would be eligible. As part of the Affordable Care Act, the carriers are giving you the option to make that extended waiting period for your employees. And if you want to do that, then you would just need to check how you have it set up. If it's an orientation period, if it's a cumulative numbers number of hours that they have to be employed for you. Or down on E, you can check that, and then you would just need to define exactly what you want your waiting period to be. Number 2, that's where you'll just list the number of employees that have submitted an enrollment application. And then to the right of that, the number of employees that have declined to enroll in coverage. For 3, you'll just check if all of your employees reside in Texas or not. And if they don't all reside in Texas, you'll need to indicate if Texas has the majority of your employees located in it. Moving to page 3, each year after you put in a group plan, you will have an open enrollment that coincides with your renewal date. So as the employee or employer, you can choose if you want to have your open enrollment 31 days prior to your renewal date or 31 days after your renewal date. It's important to indicate on here exactly what you want, because if you do it 31 days prior, and let's say your plan renews on June 1st, then any changes that come through after June 1st will not be honored by Blue Cross. And so you'll need to think through when you'll want to have your open enrollment for your employees going forward. Number 5 is going to be on domestic partners. If you wish for them to be covered, you'll just check yes or no there. For number 6, you'll need to indicate if your company is headquartered in Texas. Number 7 is just if you're a school district. And then number 8 is asking if your group has been without group coverage for at least 2 months prior to the effective date. So what that's asking is if, as the employer, if you have offered a group plan to your employees, not you as an individual. And then number 9, if you do currently have group coverage, if you'll just list in the carrier name, your paid to date with the carrier. So if you're current on premiums, you'll just write that in. And then what your current calendar year deductible is for an individual and a family. The bottom section is on ERISA. So ERISA is a federal law that was passed back in 1974. If you are completing this form, you do have to comply with ERISA. It's not going to mean much to you, most likely. If it is something that you need to comply with some additional regulations, as the broker, we will notify you of that. However, we do need to fill out part of this box. So for the beginning date of your ERISA plan year, you'll just indicate the effective date of your group policy. So if your group policy is going to be effective May 1st, just do 5/1/2020, and then the end date will be April 30th, 2021. So just put whatever your policy date's in for that. And then for the ERISA plan sponsor, you can use 501. So just write 501 on that line. The rest of that box on down through there, you don't need to worry about. Now moving to page 4 and 5, this is going to be your plan options. So if you look on the left column, you'll see all of the plans listed down the left column. And then that middle column will be if they are the Blue Choice PPO plans. And the right column will be if they're Blue Advantage HMO. So you'll just need to go down the left column and put a check mark next to each of the plans that you're going to be offering to your employees. And then follow that over to the right and also check if it's the PPO version of that plan or if it's the HMO version of that plan. Page 6 is on dental options. So if you are electing a dental plan with Blue Cross, then you'll just need to put a check mark in the dental plan option that's listed on down throughout that page. So the next page we're on is page 7. The only section you'll have to complete is towards the top where it says mandated benefit offers. And you'll just need to indicate if you want to elect in vitro coverage for your employees or not. We would have quoted your group plan without it, but if you do want to offer it, let your broker know, because we will need to requote your plan for you. If you are interested in adding the in vitro coverage to your plan, it is substantially higher. And so keep that in mind if it is something that you may be interested in offering to your employees. Okay, so the next page, page 8, is just more wording for you to read through. And so we'll go to page 9 is the next page you would have to complete. This page is going to be for group term life insurance and short-term disability insurance. So if you are going to enroll in this with Blue Cross, then at the top under section 1, you'll just check if it's either going to be offered to all active employees or if it's just to your active employees that are also covered under your Blue Cross health insurance plan. We probably would have quoted it just as one class for you. And so where it says class 1 to the right, you could just put all full-time employees. And then for the life and AD&D, or life and accidental death and dismemberment benefit amount, you would just write in there what we quoted. So if you're going to offer $20,000 in benefit to your employees, etc. For section 2, that's basically where you're going to check if you are or if you are not offering term life to your employees. So if you are going to offer it, just check on applied for. If you will not be offering it, check the box where it says not applied for. Same thing for section 3 for dependents term life. If you want to offer it, you'll need to check applied for or not applied for. So for sections 2 and 3, where it goes into all the details of the plan design, you can leave those blank and we will check the appropriate boxes for you based on the proposal designs that we ran for you. And then at the very bottom on the short-term disability, if we quoted this for you through Blue Cross, same thing, you'll need to check applied for. Otherwise, you would check on the not applied for box. And then as you go through each of the sections for the short-term disability, it would match up with what we showed on your proposal as far as the benefits that you would need to elect. All right, so page 10 at the very top, you'll just check the box based on what type of company you are and the services that you provide. Moving to page 11 at the very top, that's where you will need to either accept or decline that you will take electronic copies of your certificate booklets in your contract. If you accept it, they will email all of it to you based on the email address that you listed on page 1. Otherwise, if you decline it, then they will send you hard copies of that. You can read through the rest of page 11 and 12. It's just more verbiage for the actual employer agreement. And then that takes us to page 13. And this is where your authorized company official will need to complete that section and then sign off on page 13. When you get to page 14, the producer's statement, you can leave that page blank. That is something that Lone Star Benefits will complete for you as the producer for your group plan. Page 15 says proxy at the top, and it's an optional form. And so I would not spend the time to complete this form. So now if you're offering an HMO plan design, when you get to the form at the top that says Texas Department of Insurance required disclosure notice for all consumer choice benefit plans issued in Texas, this is only for individuals that are offering an HMO. And by law, this form has to be signed. And so you'll go to page 2 of that form, and down at the bottom, you'll see some sections you need to complete, with one of them being a signature line. This will also be the signature of the legal person in your company that will be signing all of your employer forms. This is not an employee-specific form. So the next form that we're going to look at is the employer group information form. So when you get to this form, section A, you'll just put the legal name of your company and your tax ID number. Since you are enrolling for the first time, you will not need to put an account number in there because you do not have one issued to you yet. So as you move down into section B, it says new Blue Cross clients, please check the applicable box. So you will just need to check if you were in business the preceding calendar year or if you were not in business the preceding calendar year. If you have any affiliates or subsidiaries, if you'll list those in that next section, and then you can just check yes or no. So now moving towards the bottom page of that form, number 1, that's just where you're going to check if you have filed a separate federal tax return in this past year. You'll just check yes or no. Otherwise, you can put not applicable. For number 2, you're going to total the total number of employees that you had on your preceding calendar year's tax return, including your full-time, part-time, and seasonal, and you'll just list the number of employees there to the right of that. For number 3, your answer will be no. So for number 4, it's asking if you had 20 or more full-time, part-time, or seasonal employees for each working day in at least 20 or more calendar weeks in the current or preceding calendar year. So you'll look at the current year, and if you've had 20 or more, then you'll need to check yes. Otherwise, you check no. And then right below that, during the preceding calendar year, same thing. If you had 20 or more, then you'll check yes. Otherwise, you'll just check no during or in that box. So for number 5, for current and preceding year, you can put no for both of those. Number 6 is asking if you had 100 or more employees during 50% or more of the days in the preceding calendar year, and you'll just check yes or no there. Number 7 will also be no. If you flip to the next page of the employer group information form, you'll see section C at the top. And this is basically trying to determine if you have to comply with COBRA or not. So for letter A, it's asking if you employed 20 or more full-time or part-time employees for at least 50% of the workdays of the preceding calendar year. So you'll check yes or no there. If you check yes for letter A, then the answer for letter B will also be yes. If you checked no for letter A, then for B, the answer will also be no. If you are currently COBRA eligible, and if you have any employees that are currently on COBRA, you will need to list their information in the box below that. If you have more people than spaces available, you would just need to attach an additional sheet outlining the rest of your COBRA enrollees. The next section down is talking about workers' compensation, and it's just asking if you have any employees currently out that are receiving workers' compensation benefits. You'll just check yes or no. If you do have any that are currently out, if you'll list their name and the date that they last worked actively for you. The next line down is talking about state continuation. So if you are an employer with less than 20 or more employees, state continuation applies. And basically, this is the state of Texas version of COBRA, but it just applies to groups with less than 20 employees. So in this section, it's just asking if you have anybody out or if you have anybody enrolled in state continuation, you would list their information there. Same as the COBRA section above. If you have more employees than what's listed or the boxes available, you'll just need to attach an additional form. And then the very bottom box is just if you have any dependents that are currently covered under your state continuation, you would list their information there. So moving to page 3, section D at the top, you'll need to look under number 1, and it's just where you'll check if your company did exist during the preceding calendar year. Check the first box, and then you will list the average number of employees that you had employed on business days during the preceding calendar year. If you did not exist during the preceding calendar year, check that second box, and then you'll just put what the average number of employees that you're reasonably expected to employ during the current calendar year in that next box. If your company is a partnership, you'll need to check yes or no. And then number 2 is just asking you if you are a church. So if you are not, then just check no, the group health plan is not a church plan. If you are a church, you'll check yes. And then we'll complete the rest of that for you. And then at the bottom of page 3, you will just need to sign as the employer and date the form. The last form we're going to go through is the Texas Supplemental Employment Verification Form. So the only reason you will need to complete this form is if your state of Texas wage and quarterly tax report does not list all of the employees that are enrolling in coverage. So if we have enrollment forms from you and those employees are not on your current TWC report, then you will have to complete this form. Otherwise, if all of your employees that are submitting a form are accounted for on your current TWC report, you do not have to complete this form. So if you do have to complete this form, you'll see at the top basic employer information that you'll need to fill out. You do not have a group policy number yet, and so you can leave that line blank. And then the next page of this form is where you're going to list any of your employees that are not on your current TWC report. So you'll just need to list their name, their date of full-time employment. If they're full-time, you can write 40 under hours worked per week. For the status code, if you look back at the first page, you'll see different codes that you can use. If they're full-time employees, then you would just put an F for full-time. And then to the right of that, you'll just check if they are or if they are not enrolling in coverage. And then down at the bottom of the form, we'll need a signature from an authorized company official, and then just put their title, date, and then print their name. And as the agent, we will sign the bottom of that form for you.